Hello, I'm Dr. Barken, and today I'm going to discuss a subject which is not brought up too often, and this is the issue of radiation and how to predict if radiation will work or not. What are the markers that predict failure of radiation? What you are seeing here is the coaching checklist, which I use when I do coaching session with patients that call me for coaching and question what to do when they are in a crossroad and do not know which way to turn. One of the things that I'm doing is trying to always try to check in detail all the information we can. So I call it maximum surveillance, maximum creating benchmark, and only then make a decision about treatment. And that's specifically true about radiation. So let's go now to the markers of radiation that I'm using on my checklist. Under the pathology test, you see here we have the P53. You see here we have the P53. Diagnostic test done from biopsy material may predict success of radiation. It's done in Bostwick Laboratory, and you have the phone number here, 877-865-3263. And the other biomarker is the BCL2, which is also prognostic, and it can be done in the same laboratory. The reason that I'm doing these two tests is the fact that there was a study to show on patients that had radiation. 5 years after the radiation was done, they checked to find out who had successful radiation and who did not have successful radiation. And they tried to correlate it with the tumor markers from the original biopsy. And it was amazing to find out that when P53 or BCL2 were abnormal, there were a high percentage of failure, like 90%. When both of these markers were not normal, there was 100% failure of radiation. This brings me now to 2013. I was very fortunate to meet Dr. Charles Rosser. Let me introduce you to Dr. Charles Rosser. Dr. C.J. Rosser, Charles Rosser, is from MD Anderson Center in Florida, in Orlando Health System. He is a professor of surgery. He is principal investigator in Translational Research Laboratory, and you see all the members of his laboratory. And when I met him at the halls of the American Urological Association annual meeting in 2003, he alerted me to the fact that he is actually conducting research in this area of tumor marker that show resistance to prostate cancer, but more important, how he's working on trying to find the treatment of this resistant tumor to try to increase the sensitivity of the tumor to radiation. I'm holding in my hand a review article, Molecular Fingerprinting of Radiation-Resistant Tumors. Can we apprehend and rehabilitate the suspects? So let's go now and look at the abstract of this paper. This paper was published in Cancer, July 2009, and here is the name of the article, Molecular Fingerprinting of Radiation-Resistant Tumor, Can We Apprehend and Rehabilitate the Suspects? Written by Rosser. At that time he was at the University of Florida, Gainesville. Let's look now at the abstract. Dr. Rosser states that radiation therapy continues to be one of the more popular treatment options for localized prostate cancer. One major obstacle to radiation therapy is to the amount of radiation that can be safely delivered to the target organ. Emerging evidence suggests that therapeutic agent targeting specific molecules might be combined with radiation therapy for more effective treatment of tumor. Recent studies suggest that modulation of these molecules by a variety of mechanisms, by gene therapy, antisense oligonucleotides, small interfering RNA, may enhance the efficacy of radiation therapy by modifying the activity of key cell proliferation survival pathways, such as those controlled by BCL2, which I mentioned, and the P53, which I mentioned, and the AKT/10, and cyclooxygenase 2. In this article, they summarize the finding of recent investigation of these radiosensitizing agents in the treatment of prostate cancer. So what's important to understand here that once we found what are the markers that create a situation that show us that the tumor is resistant, if we are able to modify those mechanisms of the resistance, then in other words, we basically create sensitization, so radiation will work more efficiently. Let's go now and look at another article that Dr. Charles Rosser wrote, which is a more recent one. This article was written in January 2013, and the title is Radiosensitization in Prostate Cancer, Mechanism and Targets, again by Dr. Rosser. This is from the section of Urologic Oncology, MD Anderson Cancer Center in Orlando, Florida. Let's look now at the abstract. Dr. Rosser again writes in the abstract that in 2012, it was estimated 241,740 men will be diagnosed with prostate cancer, and 28,000 will succumb to the disease. Currently, radiation therapy is one of the most common definitive treatment options for localized prostate cancer. However, a significant number of patients undergoing radiation therapy will develop locally persistent or recurrent tumor. This is a very interesting point. Persistent or recurrent. There is some feeling among some doctors and researchers that when you give radiation, it may create a situation where the tumor itself becomes more aggressive. That means if it was Gleason 6, we find out later on that actually it's Gleason 9. So is it possible that the radiation created a situation where the tumor became more aggressive, which we don't have any proof for that, or is it possible it's the persistence of disease because non-diagnosed areas with Gleason 9 survived the radiation, and then when the patient got into clinical trouble of showing recurrence, that's what the biopsy showed. It showed Gleason 9. So let's see now what are the factors that may be responsible for the failure of radiation. Tumor microenvironment is one area that may have influenced the success of radiation. Tumor stage and grade, here we could say that some people believe that high grade does not respond well to radiation. The stage, if the tumor is outside of the prostate, maybe the radiation did not hit the areas that are supposed to be radiated, and that's why it failed. And modality used to deliver the radiation, that means how did you use the technology to give the radiation? Was it guided by imaging in real time? Was it given to other areas, not only the prostate? And then the fourth point was the dose of radiation, which we are a bit limited how much radiation we could really give to a patient because of fear of side effects. And that's the area where it's so important to try to get the radiation to be more effective, which means we need to add sensitizer to make the radiation more effective. And this is the work of Dr. Charles Rosser. Let's continue. Higher doses of radiation have not always proved to be effective and have been associated with increased morbidity. Compounds designed to enhance the killing effect of radiation, radiosensitizer, have been extensively investigated over the past decade. The development of radiosensitizing agent could improve survival, improve quality of life, and reduce costs. Thus benefit both patient and healthcare system. And this is what they review the mechanism in their article. So I'm very glad to see that there is attention given to the area of radiation resistance, and radiation radiosensitizing. It's very interesting to me that one of the noted researchers is a urologist and not a radiation oncologist, and you wonder why is it that radiation oncologists do not mention to their patient prior to getting the radiation that there is a test that may tell them whether their tumor is resistant to radiation or not. And that's based on clinical observation of patients in a clinical study. So I'm bringing this up to increase the awareness that any patient before undergoing radiation should have those markers, the P53 and the BCL2 checked. That still doesn't mean that the option of radiation should be erased and not given to the patient, but maybe it will sort out for us which patient with radiation should get hormonal blockade longer period of time, which patient should get maybe more radiation to the pelvis, to the lymph nodes. So this opens the door to try to improve on the radiation and decrease the number of patients that actually fail the radiation. Thank you for listening. If you have any question, please don't hesitate and call our foundation at 619-906-4700 or write to us info@pcref.org. Take care, goodbye, have fun, and stay well. Bye-bye.